There are actually more similarities than there are differences. When you hear the word psychologist, you probably think of someone sitting in a chair with their legs crossed, listening to someone tell them about their problems. Clinical and counseling psychologists both get a license to be able to do just that. So, what is the difference between clinical and counseling psychology? Clinical psychology is rooted in the medical model. What is the medical model? That just means that the focus is on understanding the biological basis of a problem, diagnosing it, and fixing it. And this is usually in the context of a more severe mental health concern, something like schizophrenia or dementia. Counseling psychologists typically work with individuals who, for the most part, are functional in their day-to-day lives or have less severe mental health concerns. The work of counseling psychologists often includes helping people cope with experiences of discrimination based on gender identity, race, religion, or other identities. The treatment focus is usually on the individual's interaction with the world around them, as opposed to a problem with an internal origin. So let's talk about some specific reasons somebody might choose one program over the other. Why might somebody choose clinical psych over counseling psych? If you want to study neuroscience, clinical psych departments tend to have more opportunities to do that. If you want to conduct experiments with brain imaging, like fMRI scanning, things like that, clinical psych departments are going to have more resources for you to do that kind of science. If you want to do research on more severe mental health problems or work with individuals with more severe mental illness, again, clinical psychology is the way to go. Another reason that most undergraduate students probably are unaware of is that many clinical psych programs give you the option to not do clinical work at all. When I say clinical work, I'm just referring to the direct work that you do with a patient or a group of patients, which can be therapy or diagnostic testing and assessment. You don't have to be a clinical psychologist to do clinical work. Just want to make that clear. Now you might be wondering, why would somebody who doesn't want to do any clinical work apply for a clinical psychology degree? You have to keep in mind that a huge part of the work of getting a PhD is research. And some people are more interested in focusing on the research of, figuring out the root causes of a mental health problem and developing interventions and solutions to address that problem, more so than doing the direct work with a patient. Okay, what about the other way around? Why might someone choose a counseling psych program over a clinical psych program? In counseling psych programs, you're going to learn more about the research on how and why psychotherapy is effective in the first place, and you'll learn more about the interpersonal skills required to be a good therapist. Clinical psych and counseling psych students do receive about the same amount of clinical training if you're opting into doing the clinical training, but I'm talking about the curriculum, the actual sitting in the classroom and learning that way. In counseling psych programs, you're going to receive more thorough training about the science and art of psychotherapy. Another reason someone might choose counseling psych over clinical psych is if you want to learn about the role of social injustice in mental health concerns. Counseling psychology programs tend to offer more processes to talk about experiences of oppression, which is a pretty complex thing to do. Some people even summarize the differences between the two fields by saying that counseling psychologists approach an issue by first looking at the systems a person lives within, and then secondarily looking at what component of the problem might be internal. And clinical psychologists look at both of these things, but in the reverse order. So those are the main differences, broadly speaking. Keep in mind though, like I said at the beginning of this video, there are tons of overlaps. Counseling psychology students are required to learn about the biological bases and diagnostic criteria for more severe mental health problems. Clinical psych programs are starting to incorporate multicultural orientation trainings and increasing awareness of the fact that experiences of oppression can be the root cause of psychopathology. I want to point out that the name or label of a department is not necessarily going to determine your career path. It's not an end-all be-all. I know counseling psychology students, for example, who decided at some point in their training, I think I want to be a neuropsychologist actually. So they sought out the resources they needed, the faculty supported them, right? So that person is now a neuropsychologist. I also know clinical psych folks who during their graduate career did very little clinical work and focused really primarily on research, who now in their career do primarily clinical work. At the end of the day, when clinical psych and counseling psych students finish their graduate school training, we take the same exam to get the same license. If you're interested in psychology because you want to be a therapist, please trust me when I say that there are far more efficient ways to becoming a therapist than getting your PhD. You should only really apply to get a PhD if you're interested in doing research during your graduate training and potentially your longer-term career. Another question students often ask is, what is a PsyD degree? Let's do a quick recap first. So, you have a clinical psychology PhD, which often allows you to opt out of doing clinical work altogether, and honestly, is trending more in the direction of becoming a research-oriented degree. Then you have counseling psychology, which usually emphasizes pretty equally research and clinical training. Then you have a PsyD, which is a clinical psychology doctorate that emphasizes 100% clinical work. Now you might be wondering, why would somebody who only wants to do clinical work choose a PsyD over a master's degree? If you want more extensive training than what a master's degree has to offer, you might want your doctorate. A doctorate also pays better. Another reason is if you want to do psychodiagnostic testing and assessment. What I mean by that is, let me give you an example. If someone suspects that they have ADHD, they're going to be referred to a psychologist to go through a very formal protocol of questions and tests in order to receive a formal diagnosis of ADHD. You can only do that with a doctorate. Someone might choose a PsyD over a PhD program because it's a less competitive application process. PhD programs are extremely selective, and that's because the university offers full funding to PhD students. That means that in exchange for my teaching and the research that I'm doing, I am getting paid and the tuition is being completely waived. A PsyD degree, on the other hand, is an expensive degree. You do have to pay tuition. The trade-off, though, is that you can apply without being rejected over and over again, and you can just get your doctorate. If you are interested in getting a PhD, the most important thing to focus on is not the name or label of the department, but rather the faculty in the department. I personally applied to both clinical and counseling psychology PhD programs because I found faculty in both types of departments doing research that aligned with my interests. Well, I hope that this helped. If you have even more questions after watching this video, please leave them in the comments. And if you're a UW-Madison student, you can always reach out to SuccessWorks for more information on pursuing a career in psychology.